Welcome to the next episode of the Beauty Body Balance Podcast. Hi, I'm Dr. Erin Lucie, and I have with me Micah Lucie.
Hello, hello.
He's our functional health coach. And we are going to talk about peptides and all the things that go along with them, like the myths, the facts, and why they are so popular right now.
Yeah, so peptides, you probably heard that term and wonder what the heck that is. But peptides are essentially short chains of amino acids. Usually have two amino acids that are bonded together. And amino acids are really the things that we're made out of. Proteins, cells, muscles, tissues, amino acids come from proteins and they help to build us who we are. When it comes to peptides, we actually produce over 7,000 peptides naturally in our own body. So they're not some sort of weird, thing that's just created by man. It's something that's been with us the whole time. And interestingly enough, they're actually using about 150 peptides in treatments right now in medicine and developing 500 plus more. They're about to come out to the market. So if you really think about the future of medicine, peptides are going to be the thing. Go ahead.
Peptides are cell signalers, and so they are training or teaching your skin, or not your skin, but your entire body, what to do and how to perform. So we have hormones that are doing things within our cells, and then we have those peptides, and those are the things that are telling the cells what to do. So they're cell signalers or messengers. They are telling, like red light, green light, basically telling the body what to do. Is it going to repair itself? Is it going to grow more muscle? Is it going to grow more heart tissue? Is it going to grow collagen or elastin? Each peptide does something a little bit different.
Yeah, part of the problem is as we age, those peptides, those signals start to go a little haywire. The signal isn't as strong, or it miscommunicates with the cell, and some of those processes start to happen. So you see things like hormones start to get imbalanced. Our sleep gets affected. We have a harder time recovering from injury. Start to lose lean muscle, things like that. So really having these peptides that are super targeted, super direct, and the message that they're trying to send to your body is really, really helpful, especially as we age.
And that's one of the reasons that they're becoming so popular right now, is because they are more targeted. A long time ago, I used to write prescriptions for growth factor. And growth factor is just straight growth factor. There are precursors to growth factors, which would be the peptides like sermorelin, tesamorelin. That's the precursor to the growth factor hormone. And we kind of get these negative side effects when I would prescribe growth factor. If the dose was too high or they were taking too much, what would happen is their ears would grow and their nose would grow, and things that we don't want to grow were growing along with the muscle. And so now we have better technology and we have these peptides where we have more control over them. Kind of the bad thing with peptides is it has turned into the Wild West. A few years ago, the FDA took them from prescription substances to being still medical grade, but kind of over the counter. So you can get them at online pharmacies, but the problem is patients aren't knowing how to dose them, what they're for. You can just kind of order whatever, and then you start to get into some problems and complications.
Yeah, and interestingly enough, I just wanted to make one point about peptides. We've talked about this being like the new thing of medicine, but really, they've actually been in our world for a long time. Back in the 1920s, insulin was actually the first peptide that we had available to us. So it's not something that's so crazy new that it should scare you. Obviously, as we go through this and learn more of how we properly dose and things like that, it's going to be super important to have that. But yeah, it's really something we should be excited about.
Yeah, there are several different peptides. So one of the most popular peptides that we hear about and that we use in our practices is sermorelin, and that is a growth factor peptide where it's helping to grow muscle and help you lose weight. So it's working with your metabolism and metabolic health. Another peptide that we use frequently is going to be your GLP-1 family. And the GLP-1s help with your insulin resistance, and help to make your body kind of process your blood sugars better. And those are the ones that we use for weight loss and metabolic health.
It also helps to, GLP-1s, you're talking about that, actually helps to get that signaling as far as like appetite signaling back in line. A lot of times, the stress as we age, a lot of things in hormones we talked about, but GLP-1s can help to get that signaling back where it should be. So you feel full when you need to, you feel hungry when you need to, and that timing really makes a huge difference.
And that is a huge leap forward in the weight loss industry, because before, in order to have appetite control, we would have to use something like phentermine, or, you've heard of fen-phen. Those ingredients or those medications, they control the appetite, but they have a negative side effect of accelerating heart rate and blood pressure. And people were having heart attacks from that particular medication. And so it's really, really nice to have a safe peptide that can control appetite without having the heart issues that go along with it.
Yeah, and speaking of heart, one of the categories of peptides is actually more of like recovery peptides. So you think about if you have an injury, if a ligament is pulled, if you have a back injury, things like that. But I have a specific peptide that's kind of near and dear to my heart, literally, and it's called BPC 157, which is Body Protective Compound 157. Its job is to essentially go in and repair tissues, repair organs, repair bones, repair muscles, things like that have been hurt. So when I went to cardiac arrest in 2023, I was put into heart failure. And I don't know if you know anything about heart failure, but that basically means that your heart, its ability to pump blood, ability to function, isn't where it should be. And for most people, I would say 50 to 60% of people never get out of heart failure. They're stuck with that for the rest of their life. So it was definitely like a scary thing for me to hear I was in that. But I started doing cardiac rehab, which was like treadmill work, exercise work every single day, cardio work. But I also took BPC 157 along with that process. And after 16 weeks, I was actually able to be completely out of heart failure. My heart function was back to normal. Like I'd never had cardiac arrest.
Didn't have to have a heart transplant.
Yeah, which I was about to be put on the list for. So I have a lot of positive things to say about that peptide for sure. And I think one of the big parts about peptides that people don't realize, which we can get into next, is that just doing peptides on their own isn't going to be the answer to fix everything, right? It's not a cure-all. The biggest thing needs to happen is peptides work along with you in the lifestyle things that you're doing, the ways that you're living, the habits that you use for your health. That's the thing that's really going to make the biggest difference. So for example, if you're using like the GLP-1s for weight loss, fat loss, things like that, you can't just go to McDonald's and pound, 3 Big Macs a day and drink extra large sodas and expect that to work. You need to be making changes along with it, but it's going to really enhance those results, enhance that progress that you have, and all those kind of things. Even with sleep, like, a lot of people use peptides thinking, oh, they're just going to make me sleep great. Well, it's like you have to set up. You got to put the phone down. You've got to have the environment ready to go so you can actually sleep. You actually have to get in bed and let the peptide do its job.
Mm-hmm. I think that is also the hard thing about even like hormone therapy, is that we have to make sure that we are treating the entire patient. So I think patients come in and they're like, oh, my hair is falling out and I can't sleep and I'm having hot flashes and I'm losing muscle mass and my sex drive is gone. And then there's this expectation that I write a prescription for the hormones and the hormones are just going to work and change their life. And it doesn't work that way. In order for you to actually utilize, let's say I give you a prescription for testosterone, to utilize that testosterone, you actually have to do things like squats and lunges. And testosterone works really well in the muscle. So it has to be pulled out from the cells and go to the other cells where they're actually utilized and they can be functional. So there's a whole kind of chain of events that has to happen in order for you to get the benefit from your hormones and from your peptides. And we want to do it all at the same time. It would be nice to be able to just write like 4 different peptides and a hormone regimen at the same time, but we kind of have to do it a little bit, I don't know, over the next couple weeks and next couple months. It's almost like a year journey to go into all the things that we need to do. Like we start with sleep, I think is number 1. And that's really huge for Micah, is to make sure that you're getting enough sleep, because sleep is when you really go into what we call like dark repair or night repair. Your body will only repair itself and recharge those cells and energize your mitochondrial activity when you're actually sleeping in a deep sleep in a dark room. If you have LED lights going on, there's other lights in your room, it doesn't tell your brain to turn off and turn that cellular repair on. So it's so important to start in a dark room and trigger that kind of mindset of now's the time to like have your beauty sleep. And that's why it's called that.
Yeah, and I think one of the other big areas, and we really should just do a whole episode on this, but gut, as far as the overall gut balance, the microbiome balance, It's really huge for that too. If you, for example, all the things you eat put into your body go into there, and if your digestive capacity is imbalanced, if it's not where it should be, you're not even going to break down things the right way and get those benefits into your bloodstream, into your body to be used as they should. And I think something too, and you can speak more about this, but it is the Wild West when it comes to peptides. And really what is important is having a practitioner that understands dosing and timing, and how the peptides interplay with each other. You can't just throw 50 peptides into your body and hope it's going to work out. They a lot of times will contraindicate with each other or maybe affect another one so it doesn't work as well. So, for example, and you can speak more about this microdosing, but we really like the concept of microdosing, and kind of starting with that.
Yeah, especially with the GLP-1s, you might have heard of microdosing. So microdosing is where we're taking, let's say it's like 15 units for your starting dose and it goes up to like 90 units. Every medication is different, but a microdose would be like 5 units or 3 units. And it could be maybe just like once every 3 weeks instead of once a week. And that's something that we work on with your metabolic health to make sure you're at that right dose. And that is really according to like how you feel as well as what your blood results are telling us. We want to make sure that we are doing lab work before you start any form of peptides is very important, because some of the peptides like CJC, that one is made specifically to increase muscle mass, but it can also wreck your liver and wreck your kidneys because of the way that it is like focusing more so on the muscle, but it is harmful to other areas if you're not on the right dose or even the right duration. A lot of the peptides we do in, like the dose might be like with MOTS-C is for mitochondrial health. We dose that once a week. And then CJC might be 5 days a week. And then AOD might be every 3 days. BPC 157 is every day, but for 3 months. So each peptide has a little bit different dosing structure and frequency. And we might do, some of them are like every 6 months, once a year, 3 months on, 3 months off. They're all different. And you don't want to get a peptide that you're doing every day, because your body starts to get used to that. And then you're not making what you need to make. And then you become reliant on that peptide.
Yeah, and I think one of the biggest things you can do when starting with peptides is really just pick one goal, right? Because they could be super exciting. I mean, Erin and I are reading all the time about these peptides. Like, I want all these things in my body.
I do want all the things.
But really picking one goal. So, for example, it's like, hey, I want to lose some extra body fat. Okay, let's start there. Let's work with the GLP-1. Once we start to see how that's affecting your body and the way you're built and your unique biology, then we can start to expand with other things from there. But that's really the key, is let's just start with one goal that you have and build from there. And I was actually curious if you could talk about your experience with the GHK-U copper peptides.
Yeah, so I'm on a copper peptide, and I'm using a patch version, so not a injection, but it's a patch that basically helps your body to produce more of that copper peptide and utilize it in a better way. One of the things that I noticed, and I'm always a skeptic with things, but I thought this isn't going to work. But I did notice 2 things. One, my joint pain went away. I had a knee injury a couple years ago from falling down with my little boy that was riding a bike down a massive hill. And that injury went away. I can tell a difference when I'm wearing the patch and when I'm not. And then the other thing is that my hair stopped falling out. And I don't know about my skin, but because
Your skin looks great.
My skin looks,
I see it every day.
like my skin. But my hair is a big thing. I feel like I've noticed a huge difference with my hair. And then also the joint pain. I will say we went out of town and I didn't have my patches. And it kind of gave me anxiety that I didn't have my patch. I'm addicted to it. But I do take a month off in between.
Yeah, you're smart with it for sure.
Yeah.
Yeah.
But BPC 157 is one of my favorites because that was actually one of the first peptides I learned. I actually did my peptide training in Dallas with A4M, and it was with the physician that is the physician for Dancing with the Stars. And he was like, everybody's on BPC 157. Like, how do you think they can break their ankle and then they're there the next week dancing? So it was really eye-opening to see, and that was, I don't know, 15 years ago, to see like how peptides have really kind of evolved. But that's a pretty big one that we use frequently.
Yeah, and I really think the more that we understand and more we work with this, I really think it is the future of medicine. I mean, especially for the, you think of it,
Longevity.
yeah, longevity. And we have such a large aging community, especially in the United States, that it's going to be more important than ever to make sure we have these directed therapies that can really help them.
So that's the goal with the peptides, is really a customized experience to make sure that we're reaching those goals that you want, whether it is fat loss, it's increasing muscle mass, it's decreasing hair loss, increasing libido, strength. Gut health is also a big one. The peptides help regulate the gut and the lining. So if you have GI issues, it can help with that. Skin, almost everything. It does a lot. They do a lot in different ways. So if you have any questions, come in for a consult. That's what I would recommend to do. Blood work is always super important before you start a peptide, kind of during that process as well.
Yeah, for sure. And that really is how we work. We never just jump into doing something. We always want to understand where you are right now, really understand like the inside and the way that you live and your goals before we ever start anything. And we make sure we're on board with the plan together.
Great. So if you have any questions about peptides, ask in the chat, send it to a friend. If this episode resonates with you, you want to come in for a consultation, definitely schedule. You can call us at 918-340-7090 or book online at luminateclinic.com. And we'd be happy to talk to you about longevity, peptides, hormones, gut health, basically everything.
Everything. All right. We'll see you next time.